Hello, Dr. Leonard Matheson here, talking with you today about promoting interdisciplinary care at the intersection of faith and neuroscience. Today we're going to talk about the last section of the CPA Baseline Report, the Counselor-Physician Baseline Scores Report. Counselor-physician collaboration is really important. All of the research demonstrates that collaborative care creates optimal results. My experience is that most physicians really appreciate the involvement of good counselors, but the counselors don't seek out collaborative relationships with physicians. Certain problems can't be adequately treated without counselor-physician collaboration. Insomnia can be treated with medication in the short run, but in the long run, insomnia needs behavioral intervention. Obsessive-compulsive disorder is something that can also be treated with medicine, but the optimal treatment approach involves medication and behavior modification. Post-traumatic stress disorder has excellent counselor interventions, but counselor-physician collaboration is often necessary because there are comorbid problems, such as traumatic brain injury or depression. Panic disorder is a classic problem for counselors and physicians to collaborate on. There are good short-term medications that can help the panic disorder, but the panic disorder itself is one that's best treated by a counselor using behavior modification techniques. Bipolar disorder clearly requires a physician's involvement, but the adjustments that the person and his or her family need to make also require the involvement of a counselor. All of the research on depressive disorders demonstrates that treatment requires a counselor and physician to work together. Working with medication alone is only a short-term solution. Counseling alone is somewhat effective for depressive disorders, but optimal treatment really involves medication as well as counseling. The medication might be used on a temporary basis, but helps the person to get started and may be even necessary over the long term. But without good counseling support to bring about behavior change and attitudinal change, the results are short-lived. And then finally, addictive disorders. Addictive disorders can often be handled by counselors alone, but whenever we have a comorbid condition such as PTSD or a brain injury or a depressive disorder, it's really best to have a physician involved, working on a collaborative basis with the counselor. Collaborative relationships with physicians can also help you develop your practice. A substantial number of referrals that I receive are from physicians. Helping counselor colleagues develop their relationships with physicians can secure your practice as well. Physicians recognize that any one counselor can't supply all of their needs, and so having a counselor that works as a triage to identify the counselors in the community who can help a particular patient is really a good position to put yourself in. And you do that by first establishing the relationship with the physician and then reaching out to trusted counselor colleagues and making triage referrals. So, how do we do it? The last page of the CPA Baseline Report has this header. It's called the Patient Reported Outcome Measures Baseline Report, and it's set up to provide information to the physician with the patient's name and date of birth and the counselor's name and contact information, and then the counselor and client fill this out together and fax it to the physician's office. The counselor's logo and address are provided in the header. This becomes an excellent alternative to a business card. This is a simple strategy that doesn't require much effort on the counselor's part to reach out and develop collaborative relationships with physicians. This is the information that's included on the CPA Baseline Report or Progress Report. We see the 3 National Institutes of Health promise measures: anxiety, depression, and sleep disturbance, followed by the Kemp Quality of Life Rating Scale. So this is an excellent way for a counselor to establish a good collaborative relationship with a physician, and I hope that you'll give it a try. If you develop an active collaborative relationship with a physician, you'll have more referrals than you can handle. So thanks very much for your attention. Remember, there's a free trial available to you. Contact us at faithfulbrain.com.